Thank you, Dr. Owsley. I'd like to move it forward, and an important factor in public health work related to vision and eye health is the significant comorbidities that relate to vision. Dr. John Cruz is going to share his insight on the topic. Dr. Cruz is a health scientist in the Vision Health Initiative of the Division of Diabetes Translation at the CDC. His research interests include aging and vision, disability, and family caregiving. Dr. Cruz?
Well, it's just great to be with you guys this morning. I appreciate the invitation to be here, and I also appreciate your willingness to show up. I had asked Nita to airbrush my photo. The airlines have been trying to charge me for the bags under my eyes, and so I'm trying to remediate that a little bit. You know, as we were thinking about kind of these government agencies and the things that we do at CDCs, we're interested in counting and we're interested in access, so it's kind of a different point of view. But I have to tell you, I think people, think about our work, and they probably think we have a room full of scientists who are working on this. There are 4 people at CDC who are in the Vision Health Initiative. We'll be down to 3 at the end of this week. So, it's not this big entity cranking numbers. So you have 50% of the CDC's Vision Health Initiative with you today, and it's a pleasure to be with you. Well, what I want to talk about is something that I think those of us who work with older people as clinicians know very well, and that in fact older people know very well, and that is that the experience of aging is not kind of singular conditions the way we tend to approach it from a public health point of view, but in fact, as people get older, they have multiple health conditions, and they tend to interact. And there's a kind of a normative quality of that. I mean, as you get older, things don't work as well, and so we kind of work around that, but the cumulative effect, I think, can be fairly profound. So in order to set the stage a little bit, I want to share with you a report that Gerald Anderson did a couple years ago. It's from Hopkins, and he was analyzing MEPS data like Kevin did, and he was defining the dimensions of multiple chronic conditions, MCCs now is the term, and he looked at prevalence, cost, impact, and so forth. Now, the idea of a multiple chronic condition is essentially it's two or more common chronic conditions. HHS has come up with a list of 20. There's probably more. And it does not deal, by the way, with kind of age-related concerns like falls, because that's not a chronic condition. So we have to just keep in mind we're talking about a kind of condition-specific thing. Nevertheless, the work that Anderson did was profound insofar that it's influenced public policy, namely the guidelines that Health and Human Services has developed. So just give you a sense. I know you've been kind of overwhelmed with numbers today, and that's the point is not for you to remember the number, but just remember these trends. So what we know is that about 125 million people in 2000 reported one or more chronic conditions, and that will by 2030 will increase by 37%. The message is that's going to be a lot of people experiencing multiple chronic conditions. It's going to be more common, so that the problem will roll over us whether we do something about it or not. In Anderson's study, he talks about vision as one of his chronic conditions, uses a very broad definition. I think one of the things that's interesting about today's presentation is all of us up here today are scientists, and so what we want to do is to be as accurate as we can regarding the reporting of the data that we do. We want to get close to truth, as close to truth as we can, so we tend to talk about all the methods that we're using in order to draw some conclusions. So what Gerald Anderson did was he used a very broad definition from MEPS to identify eye disorders, and what stands out is that in the general population, vision disorders ranks 7th out of the 9 that are here. at 11.2%. This report's available, by the way, online. And then he suggested vision disorders representing 23% of the population ranks 5th among older people, and it ranks 3rd among children. So if we think this very broad definition of vision is is obviously in play. And some of the things that are driving it is what we've already talked about, that the older you get, the more likely you are to experience multiple chronic conditions, and the likelihood of that will increase over time. And then there are costs to that. So just is this kind of this linear relationship between the number of chronic conditions and the costs associated with that. So this is driving the discussion. Now, in HHS, then, a recent report was released about a year ago called Multiple Chronic Conditions, a strategic framework. And the Anderson report influenced that, and this report is really extraordinarily well done. It's not at all populated with conditions. It's all conceptual, so it talks about the need to understand the magnitude of the problem, that is the epidemiology and surveillance, through the development of interventions and evidence base, and then exporting that to the community. So it's a nice conceptual framework. So let me suggest some directions for our inquiry today. First question is, what is the place of vision and eye health in this ongoing inquiry in multiple chronic conditions? So if we're championing this notion of vision, where does it reside in multiple chronic conditions? Part of the research suggests that it's common. Are people who experience multiple chronic conditions more likely to, are people with vision impairment more likely to experience multiple chronic conditions? Probably the answer is yes. I give you the insight in that. And then what's the prevalence of vision impairment among people who have chronic conditions? And then it's not just the counting. That's not just what public health does. We want to know the effect. What does this mean in people's lives? And so how do we then measure that effect, and how do we begin to judge that? And then the final question, just to provoke some thinking about this, is kind of who owns the problem? What I tend to think about, because I come out of vision rehab and now in public health, and so I think about the people who have vision problems and how they may differ from the general population. So it's kind of a point of view. I'm thinking about visually impaired people, how do I define them, and how are they different? So let me give you a sense of what this looks like. Sorry, there's a lot of data on this, but the message is really simple. I looked at 2 groups, and then people with no vision disorder, and then I used a very broad definition to look at people with vision disorders, and then I identified several common chronic conditions among older people. And I'm just looking at older people just to kind of simplify this a little bit. So what you see is that people with vision disorders are more likely to have hypertension by about 10%, more likely to have coronary heart disease, much more likely to have stroke. Now, the stroke makes sense, doesn't it? So if you have a stroke, and depending on where the stroke occurs, it's likely to affect vision. So that kind of makes sense. A little bit more likely to have arthritis, more likely to have cancer, more likely to have chronic disease, and more likely to have diabetes. Diabetes makes sense as well. So if you have diabetes and develop an eye disease. So what you see, now here's the point. 2 groups, people without vision impairment, people with vision impairment. By all measures, they're more likely to have these chronic conditions. And so there's a number of things you can do about that. And this is kind of a little graphic because the graphs are easier to understand. So by just looking at people with vision impairments, kind of saying, well, people who have vision impairment own the problem. But then if you can, and I have a colleague who's leaving us, who's brilliant, and he said, he suggested looking at this a little differently. He said, well, within each of these groups of people with chronic conditions, how many of them report vision problems? So I'm taking this analysis and just kind of tilting it on its side. So now the question is trouble seeing. So if we look at the entire population of people with hypertension, 19% report vision problems. That's a lot. 23% of people with coronary heart disease report vision problems. 30% of people with stroke report vision problems. So now you think about, so then the question is, well, now what are people who are interested in hypertension and controlling hypertension, what are they doing with their 20% of their population who have vision problems, who can't read the label, who can't read the educational materials that we have presented to them, who cannot read the 12-point print in the doctor's instructions that they've received. 30% have stroke, 22% have arthritis, 19% of people with cancer have vision impairment, 35% of people with chronic kidney disease have vision disorders, and 23% of people with diabetes. So now if it's in fact these chronic conditions that own the vision problem, then the onus is on them to figure this out instead of on the vision community. So what's the effect of some of this? Let's just look at a couple of measures. We could use anything, but what I've done here is I've looked at 4 groups of people. People reporting no vision impairment, no diabetes in this case, people with diabetes only, people with vision impairment only, people with both vision impairment and diabetes. And the outcome measure is the ability to walk 1/4 of a mile. Okay, we could use anything, just kind of any activity of daily living, any measure of function. So in the general older population of people without vision impairment, without diabetes, about 16% say that they have difficulty walking 1/4 of a mile. And that's for the older population, seems pretty reasonable. And then if you look at people with vision impairment, that goes up to 40%. So 40% of people say, I have difficulty walking 1/4 of a mile. Well, that makes sense. I mean, if the streets are covered in snow and ice, walking 1/4 of a mile may be difficult. If there's cracks in the sidewalk, walking may be difficult. Maybe not because they're conditioned, walking may be difficult. So 40%, so it goes from 16% to 40%. Well, then you say that look, people with diabetes. And older people with diabetes who have no vision problems say, well, 37% say, I have difficulty walking 1/4 of a mile. Number of reasons for that. But then if you look at the population of people who have both vision impairment and diabetes, over half say that they have difficulty walking 1/4 of a mile. So it goes from 16% for people without vision impairment, without diabetes, to over 50% for both. So now it's not kind of an isolated problem, but now it's affecting most of that population. So the question is, this effect of comorbidity has a propelling effect, a compounding effect in terms of function. And so the question is, how then do you begin to move that back? So if you can address the vision problem, if you can isolate the vision problem, you can get it back. If you eliminate that or through rehab, whatever it is that you have to do, you can get that back to 36%. And then if you're going to deal with the diabetes and treat the diabetes or avoid the diabetes, then you get that back to 16%. So there's the potential to push these numbers back, and we have to think about how we might do that. Let's look at another example. This is the same thing, walking 1/4 of a mile as the outcome. I looked at stroke because of the effect of stroke, which can be fairly profound. So we got 4 groups: people with no vision impairment, people with no stroke, people with stroke only, people with vision impairment only, and people with both. So you go 16%, 50% of people with stroke report walking 1/4 of a mile, 40% people with vision impairment. Then it goes to 65%. So again, we can kind of move those numbers, the potential to move those numbers back. Another measure is just to ask people about their own health, and I think it's a good question. You just say, is your health better, worse, or the same as it was a year ago? So if we ask them, is your health worse than it was a year ago? People with stroke, people without vision impairment, without stroke, 10% say in the general population, 10% say my health is worse. People with vision impairment, 25% say their health is worse. People with stroke say 27% say it's worse, but 40% of people with both vision impairment and stroke say their health is worse. So, almost 4-fold increase. If we look at diabetes in the same kind of measure, it goes from 10%, 20%, 25% to 31%. So again, a potential to move that back toward the general population. And then just to suggest I'm going to share another study with you because it suggests again, kind of this profound nature of this effect. Linda Fried published this paper in 1999. I discovered it a couple of years ago. I was totally unaware of it, because one of the key words was not vision impairment. And what she was looking at was kind of an early study on comorbidity, and she was just looking at women 65 years of age and over. And what she calculated were the pairs. What were the most common pairs of multiple chronic conditions among women over the age of 65. And look at the pattern. This is absolutely astonishing to me. The first one, most common pair of multiple chronic conditions among older women is arthritis and vision impairment. So think about the effect, mobility, how you treat arthritis. Second is visual impairment and high blood pressure. Fourth is any heart disease, vision impairment. Fifth is vision impairment, hearing impairment. Ninth is diabetes and vision impairment. And 10 is cancer and vision impairment. Now, these are not causal relationships, by the way. I mean, they just co-occur. But of these 10 most common conditions, vision is in 6 of them, which I think is just absolutely astonishing. Okay, so what does all this mean? Well, what I've heard today over and over again is population of people with vision impairment is large, growing, and has great social and economic costs. We know that. Multiple chronic conditions is emerging as a topic of national concern, largely because of the same reasons, exactly the same things that are driving it. People with vision impairment report higher prevalence of comorbid conditions, and among people who have comorbid conditions in this report, 20 to 35% report vision impairment. Moreover, vision impairment combined with other chronic conditions compromises function without a doubt, and it compromises self-reported health. Also compromises health-related quality of life. It compromises falls. I mean, it's all these other things that we were talking about in this broad agenda. Well, so what do we do about it? Well, one is just recognize the importance of vision in this domain of multiple chronic conditions. In research, we need to better understand both the prevalence and the effect. At the community level, we need to implement programs. We're going to hear a little bit about some programs in a second. We need to improve access to vision and eye care and to develop and target evidence-based interventions. And some of that is pretty easy. I mean, just to embed efforts to include people with vision impairment into chronic conditions, health problems. Maybe just larger print, less cluttered visual presentation of materials so that the graphic artist doesn't go nuts, to better illumination, better use of contrast. So what I would suggest in conclusion is that vision is not a marginal concern in relation to multiple chronic conditions, but in fact I would assert that it is in fact central to the topic of aging and multiple chronic conditions. Thank you very much.